Healixa is a people-first digital organization that seeks to humanize care by developing and deploying simplified solutions to complex global challenges. So with me to explain exactly what all that means is CEO Ian Parker. Welcome, Ian. Good to see you again.
Good to see you. Thank you.
Lot of changes since we spoke, including a name change for the company. So Healixa is the new name. Can you kind of explain what's behind the name change?
Sure. So the name Healixa is reflective of all of our healing technologies, health tech and fintech, that are essential to our very diverse customer base. Last time we were on the show, we discussed our digital care ecosystem, which includes National Medical Group, one of the most scalable virtual care platforms on the marketplace, and the National Digital Pharmacy footprint. What we have yet to discuss, and what we're going to discuss more today, is the financial technology assets and how they fit hand in glove with the health tech assets. That's why we changed the name. It really kind of speaks to all of our healing technologies and not just a segment of them.
Okay. Yeah, because the old name was Carry Health, so that kind of implied just health, but this also includes financial, health, and all kinds of other things. So hence the name change. Okay. So is the digital healthcare ecosystem then still a part of this or still the same as what we discussed?
Yes. So the core care environment that we previously discussed has not changed at all. In fact, it's been enhanced by the fintech assets that we're building into the ecosystem. Over the last 12 months or so, we've built and compiled a complete care ecosystem, 50-state medical group, virtual care, digital pharmacy, and now we add on to that the virtual remote patient monitoring piece, and we also add on the fintech solutions. We're going to continuously improve that care environment into perpetuity. And the goal here, right, is to give not just episodic care, but to give the patient a complete continuum of care when they come into the ecosystem.
Mm-hmm. Well, and I think we talked last time about how the financial part of healthcare is stressful. It's expensive and it's a lot of paperwork and, follow up, and it takes time. And so this encompasses all of that to kind of be more of a holistic approach.
That's right. That's
Yeah.
right. And I mean, that's how you can really start to see how the health tech side and the fintech side start to marry up. A good example of that is a program that we're going to be launching here soon. So I'm happy to sort of disclose that today as to what we're planning to do here in the very near future. But if you take the e-wallet that we have, so the proprietary e-wallet, and you combine that into the care ecosystem that we have, what we can now do because of that, because we have the e-wallet, I can now go and verify your identity. I can capture your personal information. And now I can go and search all available social programs and help you find the assistance that you need to get an overall care environment for you.
Mm-hmm. Well, and that's an important point, is health care isn't just physical care. It encompasses a lot of different things.
That's right, and that's it's a very important point, and it's one that we focused on in terms of building out an entire care continuum. So, as we discussed before, we want to go beyond episodic care. So, if you look at, let's take an example. Somebody comes into our care ecosystem and they have a mental health issue, and that person, let's say, suffers from depression, and the root cause of that depression is, let's say, they're worried about putting food on the table, or they're worried about housing, or they're worried about healthcare, or they're worried about affording their medication. In our healing environment, the provider can do more than just say, well, have you thought about looking for aid? Have you thought about going out into the market, into the internet, and trying to find something that might help you? Now that same clinician can say, well, have you downloaded the social safety net program? Why don't you download the program? Let the program do the work for you. Let's go see what kind of help is out there for you. And now you can see how the fintech and the health tech marry up to create this overall healing environment for the patient.
All right. Thank you very much, Ian, for coming. And I'm sure we'll get updates as the year goes on what Healixa is doing.
Thank you. Appreciate it. Look forward to coming back.